Good afternoon. My name is Dr. Valerie Frazer. I'm a specialist in developmental, behavioral, and neuro optometric rehabilitation. Today we're going to be talking about vision and learning, and which is an important topic, especially as school is going to be starting soon. Let's see, we're going to go ahead and get started here. So I always like to start out with giving you an idea of what the problem is, because some people think that these problems are very, very rare, but actually they happen quite frequently. One out of every 4 children actually has a vision problem that can affect learning. Many of those go undetected. That's why you often call it hidden vision problems. In fact, a recent study that just came out like a month ago by Harvard Medical showed that 79% of children diagnosed with developmental dyslexia also have one or more treatable vision conditions that can also interfere with their reading and learning. So to understand that statistic or those statistics a little better, we're going to talk about what type of vision problems interfere with learning. And to start out, we need to talk about then what it means to have good vision. A lot of us think about good vision as being eyesight or maybe 20/20 vision. And when you have a vision impairment, that means you have the inability to see 20/20 oftentimes. But while these type of vision problems that affect eyesight can interfere with learning, that's not really what we're going to be talking about today, because there's many other vision problems that, again, go undetected in traditional eye exams and vision screenings that are more likely to affect learning. In fact, there's not very much association with the eyesight or needing glasses for eyesight and vision problems. To give you an idea what 20/20 means, basically when you're looking at the eye chart, it considers that you're maybe like 20 feet away, and the size of it, that's the top 20, and then the bottom 20 has to do with the size of the letter. So up at the top of the vision chart is usually like a 2400 letter, big letter E, and then as you go down the chart, the letters get smaller and the number on the bottom gets smaller. So 20/40 is usually what's required for driving, and 20/20 is what we, again, consider normal visual acuity. To give you an idea of the difference between what good vision is and how eyesight is just a portion of that, I'd use the analogy of hearing versus listening or speech. So we would never say that just because you can hear, you're a good listener, correct? So the same thing goes for eyesight and vision. So eyesight is just one small portion, similar to a hearing test, that tells you about the sight part of vision, but it doesn't give you the full picture. It doesn't tell you how you're comprehending things. It doesn't tell you how efficiently you're getting that information in. Most vision screenings are also only looking at distance eyesight and not looking at all at near eyesight. And near eyesight, of course, is going to tell you much more about how you're able to read and write. But more importantly, it's how efficiently you're getting that information in. And when it's not getting in efficiently, that's when you can start having trouble with how it interferes with learning. So today we're going to talk about some of the visual skills that are important for learning. We're going to talk about eye teaming, eye focusing, eye tracking, and visual processing. We'll start with eye teaming. Call that a visual efficiency skill versus visual processing, which is has less to do with efficiency of how the information is getting in, but more of how we're, again, processing that information. So we have 2 eyes, and the brain has to make one picture out of those 2 images that the eyes create. So in order to do that, they need to be pointing in the same place at the same time. And this is also what gives us good depth perception, eye-hand coordination during gross and fine motor tasks. I'm going to show a video here of a young man who isn't able to converge his eyes at all. This is a very severe case. So you can see he's supposed to look at the ball, and first his eyes don't move towards each other at all. But if he works hard enough, he can start to get it. So I would say that even though this boy can have 20/20 eyesight, his eyes aren't working very efficiently at near because of that. Now, a lot of kids can do that test, but have trouble um, with sustaining convergence over time. But that's a lot easier to see. So what happens if you aren't converging your eyes in the same place at the same time? Well, you can get double vision. So this is an example of what some double vision can look like. There's another example. Sometimes the words will just get blurry or seem like they're squished together. Some have trouble with not being able to converge their eyes enough, and some converge their eyes too much. And some just have a general difficulty just coordinating the two eyes together as they're doing tasks. But poor eye teaming skills can cause eye strains and headaches, as you can imagine. But sometimes what someone notices is that they just can't read fluently because it's the extra effort that it takes each time they move their eyes. They have to refocus and reconverge them. And that can lead to decreased comprehension, reduced attention, or even avoidance of the near task. Reduced depth perception. It can affect eye-hand coordination, but not always. And then difficulties with handwriting or even lining up numbers in math as well. The next visual efficiency skill that I'm going to talk about today is visual focusing, or the medical term on that is accommodation. So that's the ability for the eyes to focus at near. So when you look far away, there's a lens in the eye, and that lens is controlled by muscles. And those muscles relax to see far away, and they have to do some work to see up close. That usually develops well by about 4 months of age. But what happens sometimes is it doesn't develop right, or maybe something happens along the way to kind of interfere with that process. And for kids, then they start having trouble with blurriness and having to work too hard up close to be able to keep things clear. Now, in adults, we have to start having trouble with our focusing system for a different reason. And that's because the lens itself gets harder to move. And so it's not a muscular problem, it's more of a structural problem at that point. Excuse me. So poor focusing skills can cause many of the similar symptoms as poor eye teaming skills, including blurry vision or distorted vision near. It also can create those eye strain and headaches, but also, again, sometimes that's not the chief complaint. Sometimes it just interferes with the reading fluency or in comprehension, mainly to difficulties copying from the board. So if they have trouble switching focus from distance to near efficiently, that'll lead to issues with copying back and forth. Again, it can lead to difficulties with attention and also avoidance behaviors as well. The next visual efficiency skill that I'm going to talk about today is eye tracking. So eye tracking consists of really 3 different skills. So fixation, which is actually just the ability to hold your gaze on an object without moving your eye. Saccades is being able to move from one point to another accurately. So that'd be what we do when we read. Then pursues the ability to follow a moving object, has more to do with sport and general motor coordination. Here's an example of a kiddo who has some trouble with his eye tracking skills. So there's a developmental process that goes on. When we're born, we fixate right away, we learn to track right away, but we often have to do it with moving our head. By age 5, that should get much easier, and you should start to see that they can actually move their eyes without moving their head. This is something this little kiddo hasn't learned, so now we're telling him to go ahead and try to get still. He still has difficulty doing that and takes a lot of concentration in order to do it. And, those separation of eye movements from head movements should be starting to be better developed by age 5, and then completely developed by age 10, where you actually get a lot of accuracy without any head movement. But generally, 7 or 8-year-olds should be able to do this task with very minimal head movement. They might still have some difficulty with the accuracy. The accuracy improving 8 and 10 years old. Here's an example with reading that shows the difference in eye movements. The one on the left is someone who's struggling with those eye movements, the saccade movements, where you're moving from one place to another. They're bounding around, their eyes are going backwards at times. The example on the right is someone's eye movements who are doing more of that typewriter effect where they're going forward the whole time. This is taken using a instrument that we have in our office called a readalizer. Readalizer will actually track the eye movements um, as they're reading a paragraph and tells us a lot about how efficiently their eye movements are while they're reading. Some symptoms of poor eye tracking would include losing their place, skipping lines of words, requiring a finger to keep their place, especially past the age of 8, making lots of careless errors, not completing their work on time, trouble lining up numbers in math, and moving their head when reading, and then trouble with attention. So often these visual efficiency skills, we often see all three of them not working well together, and that's where the increased effort can also lead to some fatigue, and sometimes it never gets to that point where they just avoid or have inattention fairly quickly in the whole process. That 79% figure that I showed in the beginning of developmental dyslexics with visual efficiency problems work at these three skills. So 79% of developmental had deficits in one or all of these three skills of eye teaming, eye tracking, and eye focusing. As you can imagine, if the visual efficiency skills continue to be a problem, that often leads to a lot of frustration and sometimes acting out behavior problems. Sometimes they're labeled as lazy or attention deficit, when really there is an underlying physiological cause for their not being able to do the work. Oftentimes, it's also important to note that kids don't always know that what they're seeing is not how it's supposed to be seen. So I can tell you numerous number of cases where I've worked with kids where the parents had no idea that they were seeing double, or no idea that they were seeing blurry, or that their eyes hurt every time they read. So I think it's really important to ask kids who are struggling those questions to ask about their symptom reading to see if that could be part of the issue. Visual information processing is about interpreting what we see. So I use, if you guys remember the Facebook went up all enraged about the dress. So is it a blue dress, a gold dress? It's a dress, but people are interpreting the color differently. And that has to do with how they're interpreting what they're seeing. We're not going to go into exactly why that happens in this particular case, but it gives you an idea that two people can see the same thing, but have a different interpretation of what they're seeing. So we call those visual skills that have to do with more with the processing of visual information. So a few of those skills that we're going to talk about today include certain visual analysis skills, which include finding the details, seeing details, separating it out from the background, which is visual figure ground. We're going to talk about visualization, visual directional skills, and visual integration skills. So visual discrimination skills are the ability to notice details. So on the left, we have a pretty easy example. We have big little triangles, shapes that are different colors. They're actually called attributes, where we work on some visual discrimination skills on usually younger patients. But those ideas of understanding what's different, what's the same, are really important when we get to reading, because oftentimes words can look very similar, like on the red that shows the cat. One letter that's separating those two. If you can't pick out that detail, you're going to misunderstand the context. Visual figure ground is about finding the crowded background. So here we have, if you can tell, there's actually horses there, hidden in the background there. You can kind of see several horses with their legs, or hopefully you can pick them out there. Oftentimes this plays into real life, so your shoes, means it's in the fridge, find the correct tool in a toolbox. Those are examples. But also as you're reading, being able to separate out words from each other, scanning for relevant information. And it's also highly related to some eye tracking skills as well. Directional skills have to do more with understanding of rights and lefts, body awareness, and as they relate to reversals. So when we talk about directionality skills, it becomes an issue, especially when we're talking about reading, because if you don't have good directional skills, you might reverse letters or words or numbers. Go through a developmental process with this as well. Understand that the two objects on the left, both regardless of how they're orientated. But on the right, the orientation of letters are very important. So if you don't understand concepts of direction and left and right and how things can be going a different way and it means a different thing, then you're going to have trouble with reversing of letters. Again, this goes through developmental process. So the concepts of right and left start to solidify in between age 5 and 8. They usually should be pretty solid by age 8, so they understand the directional concepts enough where you shouldn't be seeing very many reversals, if any at all, in their reading and writing by age 8. Visualization, visual span, and memory. So these skills I put together because they all kind of have to do with being able to make a picture in your head. That visualization is. If you have good visualization, the visual span, which is when something's shown to you very quickly and being able to remember it. Think about like a photographic memory on the high end of visual span and visual memory kind of go together in that way. So these skills are very important for faster word recall, being able to recognize sight words because you can't sound those words out. Comprehension, so if you can visualize a story, you're much better able to remember what the story is about. Spelling, many words are spelled more visually than phonetically, so this plays an important role in understanding what the word should look like, especially reading it. Remembering math facts and mathematical concepts. There's a lot of visualization that can go on when you're trying to understand not only word problems, but understanding how the relationships between numbers. And then recall of just general information. So if you can visualize things from thinking about like visualizing where a certain diagram in your notes when you're taking a test, geography, being able to picture that map in your head and remember where certain cities are. That's all has to do with how well you can visualize and then with that, the visual memory part. So that's why oftentimes that statistic about 80% of learning as visual comes from when we look at something, get a complete picture of what's going on versus sequentially. Language is a very sequential process. Vision tends to be much more simultaneous. You can get a lot of information from visual system that would take a longer time to learn if you're doing it sequentially through language. And finally, we're going to talk about so visual integration skills. Visual auditory is able to put sounds and work on what you see together, and visual motor, which is more handwriting, excuse me, and eye-hand coordination. So those two skills, visual auditory is due when we read, especially when we read out loud. Visual motor, of course, important for the writing aspect, and then for sports as well. So today, we've talked a lot about how vision can impact learning. I would say if you do nothing else today, you should really think about the importance of yearly exams for every child. Now, And I mean every child, not just those that are struggling in school. So it's very important to have the eyes checked yearly because the eyes grow and the child changes. Things can happen along the way. But if a child is having trouble with vision and learning, you really need to think about doing a more thorough exam to look at all of these visual areas because a typical eye exam will mostly look at the more isolated functions, visual acuity, um, whether or not the person needs glasses, um, are the eyes aligned with each other, do they have depth perception, and it'll look at eye health. Now, it's important to note that the only thing that a vision screening does is look at the visual acuity. So there's a lot of things else that can be going on with the child's eyes that aren't going to be picked up in a visual screening test. Now, a vision and learning exam basically includes the typical eye exam scene, plus there's going to be more tests that look at the focusing efficiency, are the eyes working together with team and the convergence. There's going to be a lot of eye movement tests to see how that's functioning. And then if deemed necessary, also the visual processing evaluation to look at how the patient is processing the information that's around them. So I always say, though, garbage in, garbage out. So if you're having trouble efficiently getting the information in, you're going to have some trouble with the visual processing of the evaluation oftentimes. So then we get to the point, are these conditions treatable? And the answer is yes. Some of the treatment options that we look at are lenses that might reduce the demand on the eyes or improve the visual efficiency, and then optometric vision therapy. And what is that optometric vision therapy? Well, it's an individualized program, and it's designed to remediate those visual skills and visual information processing difficulties that I talked about today. You cannot, I think, do effective optometric vision therapy without the use of lenses and prisms and filters to train the visual system. So some OTs might work on tracking, or there might be other programs that work on just a smaller part of the visual system. But if your eyes aren't working together, you're going to have a hard time tracking. A lot of what we do in therapy involves basically using those lenses and prisms correctly in order to help guide the person into a more efficient visual system. We need to get this to the point where it's like riding a bike, where you just do it. You don't have to think about it. Generally, optometric vision therapy is going to be a specialty of optometry. There aren't many ophthalmologists that specialize in this area. But it does have a very high success rate for the treatment of the problems that I talked about today, especially the convergence, focusing, and tracking problems have 80% plus success rate with optometric vision therapy. Another word about that is that the doctors that specialize in this area, like myself, we usually have specialized training beyond optometry school. So they have the designation FCOVD after their names. And then generally that means that they've gone through additional training in order to become a specialist in this area. While every optometrist receives some training in vision therapy, unless you go through additional courses, it's difficult to actually be a specialist. So thank you for your time today. If you have other questions, feel free to give us a call, 608-849-4040. You can also check us out on Facebook and our webpage. There's also a resource called covd.org, and that basically will is the organization that oversees the fellowship process. They have a lot of information on their website. If you're looking to talk to other parents who have gone through the process already, you might want to check out the Vision Therapy Parents Unite Facebook page. It's a support group for parents, and it gives you more information about what vision therapy is and what type of other problems you might encounter with the visual system. So feel also free to contact us via email. That our email address is info@newhorizonsvisiontherapy.com. Thank you.